The next one we're going to take a look at then is the Diabetes Forum. This is a free app that does exactly what it says on the tin. It's a forum for diabetic patients. What I was most impressed with this app was the amount of engagement from its community. There are 320,000 users of the app at the moment and over 2 million posts on the forum. In fact, the forum advertises that if you post a question on there, the average response time is 4 minutes, which is pretty incredible. I think this is a great resource for new diabetics. As a GP, 10 minutes is barely enough to explain what diabetes is, to break the diagnosis, and to start talking about treatment, let alone trying to give the patient some understanding of what it's like to live with diabetes. And that's where forums like this help. They give a lived experience of diabetes. There were discussions on there about low-carb diets, ketogenic diets, diabetes during Ramadan or fasting, and what it's like to live with an insulin pump, topics which many GPs just won't know much about. If you're wondering how patients can begin to navigate over 2 million different posts on the forum, the answer is the moderators. Moderators are able to flag useful advice, or will sometimes summarize the discussion in the forum, pull it together into a single article and flag that. So it does make it easier for new users to navigate. The moderators are also responsible for enforcing the rules of the forum. The two most important ones being don't cross-post from the Type 1 forum to the Type 2 forum, and don't give advice about changing medication. The only drawback to the app, though, is the obvious. The users and the moderators are not healthcare professionals. In fact, I couldn't really find much information on who the moderators were at all, in terms of whether they were paid, whether they were trained, did they work shifts, did they have conflicts of interests. It's the same for any forum, and I wouldn't say don't use it for that reason. In fact, I think I'll start recommending it for my own patients. But I think it's important to stress how it's used, to emphasize that there aren't healthcare professionals moderating it, and to suggest that if the patient is thinking about any changes to the medication or radical changes to diet or lifestyle, just to check in with their GP first.